So after predisposing factor, we'll see most common urolith in different species. First, in case of cat, from the name itself, Ca, that is calcium oxalate. Calcium oxalate is most common. Number two is dog. Number two is dog. Most common calculi are struvite in case of, also known as magnesium ammonium phosphate. Struvites are most common calculi in case of dog. But in case of dog, there are some breed also which are having common calculi. For example, Dalmatian having urate as common, GSD having S for silica, that is silicate crystals as common, and there are some Dachshund breed and they are having common cystine. So these are some breeds having, but overall dog have the most common struvite, that is MAP, and these struvites are always secondary to UTI, urinary tract infection, because of your staphylococcal proteus or other things. After this, we'll see cattle and sheep. If these are on grazing pasture, then mainly silicate, because plants are rich in silicate. So silicate crystals will be there. If these cattle, sheep and goat, if they are feed lot, means they are eating grain rich diet, then the most common or mainly struvite mainly. So if they are on grazing pasture, answer will be silicate urolith. And if these cattle, sheep, goat mainly feed lot, you are giving them grain rich diet, then struvite mainly. The next is horses. In case of horse, most common calcium carbonate, and the form is called as calcite. These are the most common in case of horses, and horses have urolithiasis. In horses, it is less common as compared to ruminant. So in ruminant, there was one more point, that oxalate crystals are rare in ruminant. They are rare in ruminant. In case of horses, these are the calcium carbonate. The most stable form is the calcite. So these are the common urolith present in different species. Now we'll see most common site in different species where the urolith get deposited. In case of cat, it is the urethra and where near to the orifice, near to the opening. In case of dog, behind or caudal to os penis, caudal to os penis. In case of cattle bull, it is caudal to sigmoid flexure. In case of buffalo bull, tip of the penis, which is equal to sigmoid flexure, means the probability of urolithiasis is equal in sigmoid flexure and tip of the penis in case of buffalo bull. Next is your male goat or your male sheep. They have urethral process. This is the penile tip. At the penile tip, they have one thread-like structure which is known as urethral process. At this point, means at the base of urethral process. At the base of urethral process, in case of male goat, your calculi is found. In case of sheep goat, the calculi is sand-like, fine. It is fine, it is sand-like and multiple in number. Multiple. Sand-like. In case of cattle bull, this is single discrete type. One more species where the most common site is horses. Number 6, horses. In case of horses, most common site of urolithiasis is bladder, urinary bladder, as compared to other site. This is the most common. Cystic calculi are more common in case of horses. So these were related with the most common site of the urolith formation. Now we'll see in case of dog. In case of dog, how to approach a case of urolithiasis. Number 1 is first we take history. We take history. In that history, there may be partial obstruction, that is dribbling of urine, or there may be anuria. This is surgical emergency. This is the surgical emergency. So first we'll go for taking radiograph. First we'll take radiograph to see the obstruction site. Obstruction site. On radiograph, there may be that stone may be of two types: radio opaque calculi, and radio lucent means black calculi. Which are the calculi? They are you can see on plain radiograph without any contrast radiography. And which are the stones or calculi? They need contrast radiography. So these are your cystine and urate. These are radiolucent, means you cannot see them on simple plain radiography. On plain radiography, these are black. So in that case, if these are black, in that case, we go for contrast radiography. In this case, we go for contrast radiography. So what are the calculi which are radio opaque? Means they are white, you can see easily on radiograph. They are calcium containing calculi like calcium carbonate, calcium oxalate, and one more is the silica, that is silicate, which are found in the GST. Suppose you are examining a dog GST, then it is most commonly it contains silicate. So silicate is radio opaque calculi. You can see them easily on the radiograph. If it is urate, you are examining a patient of Dalmatian. In case of Dalmatian, most common urate are commonly found. So urates are radiolucent black. So in that case, you will not be able to see them on radiograph. So in Dalmatian, you should go for the contrast radiography, or other option is USG. You can see them on ultrasonography. So after radiography, what we find in case of dog, after radiography, this is the bladder and this is the urethra, and this part is the os penis in case of dog. Just behind the os penis, at this point you have calculi. That is the most common site in case of dog. So this is the bladder, and here you have rectum. This is bladder, and this is perineal urethra, and this is, because it is a part of os penis, so penile urethra. This is the opening. So rectum, bladder, perineal urethra, and this is the os penis. This is the os penis bone, and this part of urethra is penile urethra. So after radiography, if this calculi is silica, then it will look like white radio opaque. If this is the case of Dalmatian, this calculi will be urate and it will not be seen. So we can go for contrast radiography or ultrasonography. So Whatever the calculi or modalities, after confirmation, the calculi is present in most of the cases just behind the os penis, just caudal to os penis. This is the most common site. So the next step of what is our next step? The next step, if we know that there is a single calculi, there is a single calculi. So it is better we can use one catheter, and with the help of this catheter we will try to push this stone back into the bladder. This technique is called retrograde hydropropulsion. Retrograde So it is easy to dislodge this stone into the bladder with the help of technique retrohydropropulsion. So after we throw this stone into the bladder, then we can go for cystotomy. We can go for cystotomy. We'll make an incision on the bladder, take out the stone. So in case of dog, the first step is push this stone into bladder, retrohydropropulsion, and then from the bladder take out, that is the cystotomy. The second case is if in this dog, if there are multiple stone in this pathway, multiple stone, then it is not possible to throw them into the bladder. Then you can go for only one option, that is urethrotomy. That is urethrotomy. In dog, the commonly used technique for urethrotomy is scrotal, not prescrotal. It is scrotal urethrotomy. If you are unable to use this technique, if multiple stones are present and you cannot push them into the bladder, you can go for urethrotomy. Scrotal urethrotomy in case of dog. Suppose there is only one stone. Suppose there is only one stone at this place, and we'll go for the retrohydropropulsion. This is the catheter. This is the catheter. So first we catheterize the animal. We are keeping catheter inside the lumen. We'll allow this catheter to go up to what length it can go. Suppose this is the calculi and it can go up to this. Then the next step, first we catheterize this animal. Next step is you are standing here. Keep your one finger per rectally. Keep your one finger per rectally like this. So at this area, just beneath the rectum, perineal urethra is located superficially. Superficially. If you put your finger through the rectum, you will find the perineal urethra. Two parts of urethra, perineal, penile. You put your finger and you press the perineal urethra. So because it is superficial, so that you can easily press it. After this, what happens? This part is closed with your digital pressure. You apply the pressure and close this. So this side is closed. Here you have stone, and this is your urethra. We passed our catheter from here. So this part is also closed with catheter, and this part is closed with the digital pressure. Now the urethra become like a closed chamber. You push the normal saline into urethra. Because of this, because it behaves like a closed chamber, the urethra will distend like this. It will generate lot of pressure in the urethra. Then the next step is, when it generates lot of pressure, you remove your finger. Because of this pressure, if you remove your finger, this stone, because of normal slide, lot of pressure, it will go into the bladder. Then you can perform your next step, cystotomy. So in case of dog, first we catheterize the dog, second we keep finger per-rectally and we close the urethra at this. The urethra is closed at this part, it is closed as here. Then push the normal saline, it will distend in case of dog. So if I revise, this is the bladder and this is the urethra and this is the rectum. Below